am I doing this? I wouldn't do this if our congressman would hold one of these. And so, you know, that's... So I want to get started. I did not anticipate this. I didn't anticipate this large of a crowd, to be honest with you. So I'm very encouraged and appreciate all this. I should have anticipated this is a critical issue for all of us. Let me give a couple of ground rules and then we'll get going. What I'd like to do is stay on topic with HR 3200. We were told that they were going to vote on this thing before August break. Then we were told that they were going to do it right soon after August break. So when I set it up, you know, the urgency seemed to be there, so I put this together in just a few days. And, you know, we can talk briefly about some other solutions, but I really just want to focus on it. We've got two people that are videotaping and also with audio, and so I plan to make sure our congressman hears from you through the video as well. And so that's... is a practicing physician for 30 years in Royal Oak. He's been selected by Crain's last year, Crain's Detroit Business as a Physician of the Year. He's received numerous awards for his work in childhood obesity and has been involved in other times. Back in 1994, he fought back some government health care control as well, so was very active in lobbying to protect freedoms. And so if you'd welcome Dr. Paul Burke.
Mayo Clinic said on the Center for Policy website that quote, HR 3200 misses the opportunity to help create higher quality, more affordable health care for patients. In fact, it will do the opposite, unquote. Cleveland Clinic CEO, Dr. E. Cosgrove, in an article in Newsweek August 7th of this year, said that HR 3200 would make the problems with health care substantially worse. And then finally, the Wall Street Journal kind of summarized these two and said that, quote, the more we inspect House Bill 3200, the more it looks like it to be one of the worst pieces of legislation ever to come out of Congress. So I think that...
Dr. Howlett did join us, and I'm very happy. Dr. Howlett, and I'll finish with you, John. Did you want to say just anything?
This is my introduction. My name's Dave Howlett. I'm a family doctor. I've been in Rochester about 30 years. My father was transferred down here to Rochester with Ford Motor Company when I was 15 years old, so I graduated from Rochester High School and went up to Canada, did my medical school, worked up there for about 3 to 4 years, and then Dr. Bruce Kresge encouraged me to come down here, and I've been here since. There's a huge difference between the Canadian and American medical system. There is a total control over access to care in Canada. Personal experience I had up there was basically the government runs everything. It runs the number of stress test machines, the number of CAT scans, the number of x-rays. They're allowed to be in an area. Where I was, it was Peterborough, a town just outside Toronto, about 200,000 people. We were only allowed to have 10 stress test machines. And they were only allowed to run Monday to Friday, 9 to 5, an hour break at lunch, a half-hour break in the morning and the afternoon. And when you called up to get a stress test, if you felt there was something wrong with your heart, you got the next available appointment, which is usually 3 to 4 weeks down the road. And no cardiologist was allowed to see you until you failed your stress test. And on 2 occasions, one sad one, I had a 42-year-old guy come in, and he said, when I was out shoveling snow 2 days ago, I got sharp stabbing chest pains going down my left arm, feeling weak, shaky, lightheaded. And I went in, sat down, went away, went out a half hour again to shovel some more snow. It came back again, so I sat down, and my wife said, I can't shovel any more snow until I saw the doctor. And his EKG, everything was normal. To make a long story short, I said, you know, it really sounds like it's coming from your heart, so when we have to get a stress test, the fastest he could get in was a 6-week wait. 3 weeks later, we had another big snowstorm. His wife looked out a half hour later, he was dead in a snowbank. He was 42 years old. Now, just from my point of view, I checked with one of the local doctors. I said, this is terrible. I said, am I likely to be sued? He said, no, you gave him the form for the stress test. He said, yeah. I said, that's fine. Because in Canada, there are no jury trials when it comes to malpractice, it's all the judge. So all the judge is going to ask is, did you give him the stress test form? If the guy died waiting in line, well, that's just the way things are. You've done nothing wrong, and that's just the way things are. And interesting thing, his wife happened to come in about 3 weeks later with a child with an earache, and I just asked her, now, how are you doing? She said, well, I should have thought he wouldn't live that long. His father also died young. Canadians accept a much lower standard of care. The other situation, this goes back about 16 years ago, but 16 years ago, very coincidentally, I had 2 uncles, both, one in Ottawa, the capital of Canada, one in Washington, D.C., and they both went in to see their doctors and found a nodule in their prostate. The uncle in Washington, D.C., in 6 weeks had the nodule biopsy. They found out it was cancer. We met with 2 different specialists, decided what to do, and had the surgery done within 6 weeks. The uncle up in Ottawa, it took 2.5 years to get the treatment. Because once the doctor felt a nodule, he had to then get on a waiting list to have his PSA drawn. And then he had to wait 3 weeks to get back into the doctor to get the results. And then it was a 5-week wait to get the ultrasound. And then 3 weeks to get back and see the doctor to get the results. And then 3 months to get in to see the specialist. And then 2 months to get the biopsy. And it just goes on and on and on. The other way the government controls healthcare is by controlling the number of beds and the number of operating rooms. At Crittenden right now, there's probably about 9 operating rooms. The government, within 3 or 4 years, will shut that down to about 5 operating rooms. So every surgery takes longer. The average waiting list for a hysterectomy in Canada is 4 times longer than the United States. So there is a control of healthcare. And the other thing, just to pass on, is the Canadian healthcare system will not work here unless they totally change the entire legal system. In Canada, again, there are no juries. There's a judge, he sits there, he decides right and wrong. If the doctor did something wrong, then the punishment is there. But if the doctor didn't, then the case is thrown out. And almost every analysis of malpractice cases where they say the doctor, or say, let's say it was found against the doctor, he did something wrong, when they talk to the jury afterwards, the juries will say in 85% of the cases, well, the doctor actually didn't do anything wrong, but those people were really unfortunate. They need a lot of extra money, so we felt we had to find the doctor wrong to be able to give them lots of money. And we're not going to get any changes like the Canadians unless we also accept that legal system. And one thing you can be guaranteed of, they're not going to take all malpractice cases away from all lawyers. If you have specific questions, we'd be more than happy to answer it. But in Canada, it is a much lower standard of care. People do not get upset when their husbands, wives die because that's just the way things are. Americans tend to think that each of us is very, very important, and we want to get as much out of life as we can. Canadians are more willing to go with the herd, and a bunch of people die here and a bunch of people die there. So that's good for the greater good. But Americans kind of like each of us, and we love our children, and we love our relatives, and I don't think most Americans are willing to sit back and see people die needlessly. Thank you.
All right. What I came here to say is that this House bill, or this Senate bill on health care has nothing to do with health. It has nothing to do with care. This bill is about grabbing 1/6 of the economy and throwing it under a socialist system. And
This is the biggest takeover by the government of 1/6 of our economy that has ever been conceived. This thing is a bureaucratic nightmare, and it is going to control your life from day one until the day you die.